You were diagnosed with lymphoma.
I actually diagnosed myself in between patient visits when I got the report back that it was Hodgkin's lymphoma. It didn't feel real.
This is the story of Dr. Cindy M. Howard.
What was amazing about it is it increased really my level of empathy that I now had, because even though there is never going to be a patient that has the same walk as I did, I now can appreciate a little bit more what it feels like to hear the word cancer and know that there's something in front of me that I needed to overcome.
She's changing lives through her expertise in sexual health, GI disorders, and even pelvic dysfunction.
What do you wish everyone knew about sexual health but probably don't?
We should be able to engage in sexual activity until we're dead, if we want to. There is no limitation to prevent that.
What specifically is taboo right now in the world of functional medicine?
It's this joke in my office that you can come in with a sprained toe and I'm going to ask you about your bowel habits.
But this episode isn't just about expertise. It's about resilience. It's about choosing your response when the universe throws its hardest challenges.
My mindset is that they were going to kill me while they keep me alive, and I needed to clean up the terrain that they were going to destroy while they get rid of the Hodgkin's lymphoma.
But the real question is, what made Dr. Cindy question her entire approach to healing, and how did it change the way she treats her patients today? Listen now and find out.
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown, here with my co-host and friend, Melissa Gentile. Today, we are so excited to welcome Dr. Cindy M. Howard. Dr. Cindy is a board-certified chiropractic internist and nutritionist with extensive experience in functional medicine. She has an unfiltered approach and is proud to tell it how it is. Dr. Cindy is known for her work in pre- and post-concussion nutrition, headaches, sexual health, male and female pelvic disorders, GI disorders, nutritional blood analysis interpretation as well. In 2020, Dr. Cindy Howard was awarded the Chiropractor of the Year from the Illinois Chiropractic Society. In 2023, she was awarded the Nutritional Professional of the Year from the National Nutrition Standard. Her new book, Positively Altered: Finding Happiness at the Bottom of a Chemo Bag, celebrates the belief system that helped guide her through her fight against Hodgkin's lymphoma. The belief that we get to choose how we approach our lives and how we react to what the universe throws at us. Dr. Cindy just celebrated 10 years since her last treatment, and we are just thrilled to have her on. Welcome, Dr. Cindy.
Oh, thank you. I'm thrilled to be on. This is great. Super excited to see where it goes.
We're so excited to have you on, Dr. Cindy. And I really want to start out with your personal journey and your personal story. So you were diagnosed with lymphoma, which really is a life-changing event for anybody, let alone like a healthcare practitioner. So what did that moment of realization feel like? How did it change how you saw yourself both as a doctor and, as a person?
Well, that's a loaded question and requires, a lot of time to answer. So I'm going to try to pack in all those thoughts into one thoughtful answer. It was interesting because I actually diagnosed myself, which is a very strange phenomenon, I guess, because usually you're sitting across the desk from another doctor waiting for either good news or bad news. And I got to tell it to myself in between patient visits when I got the report back that it was Hodgkin's lymphoma. I was moving from one room to the other room and thought, oh my goodness, I've got to focus on somebody other than me, which is a really interesting challenge when, you get something kind of scary like Hodgkin's lymphoma. What was fascinating about the whole experience is it didn't feel real. And you hear that a lot of times, right? Sort of this denial, it doesn't hit home for a while. You hear these words. What does it mean? And yet I've been practicing for so long. I mean, I knew what the words mean. I knew it, could potentially be very scary and life-threatening. And yet I didn't want to feed into that. The gift in that for me, I think, was I came with a lot of knowledge and expertise already in this space because I've worked with patients who have walked through different types of cancer and it been, that level-headed, logical support system, and knew that there were certain places I needed to look and what I needed to do. But what was amazing about it is it increased really my level of empathy that I now had, because even though there is never going to be a patient that has the same walk as I did, I now can appreciate a little bit more what it feels like to hear the word cancer and know that there's something in front of me that I needed to overcome. And figure out how to do that in a way positively instead of, becoming a victim to the disease. So the empathy that I learned on top of what I already had, I think really elevated that experience for me with patients. And it's fun now. I mean, that sounds terrible, right? To say it's fun to help people walk through this, but there's
Purposeful.
there's a camaraderie almost, right? When you're part of the club that you don't ever want to be a part of, but you are.
We've interviewed a lot of really impactful practitioners on this podcast, and I feel like all of them start with this personal story where they had to walk the walk for a little bit. And I feel like it just really enhances your ability to be an impactful practitioner, because you know what that person on the other side of the screen or other side of the table, the desk, what have you, is going through. And so you mentioned you were already in this space when you got the diagnosis, or so you were already working in functional medicine?
No, yeah, I've been so I've been practicing for 25 years, and I'm old enough that we didn't call it functional medicine 25 years ago. That's really sort of a new term that's been thrown out for the type of medicine we practice. And it was alternative practitioner and holistic practitioner and natural practitioner, and nobody knew what to call us. We just weren't mainstream, right? It wasn't the typical route that most physicians practice. So I've been doing this work for so long that it wasn't alternative or odd or new to me when I had to walk through the diagnosis 10 years ago, because I was already doing all of this. So it was a great gift to have that education versus walking into something going, great, now what? And who do I turn to? And how do I get this type of help?
And when you first got this diagnosis as well, what was going through your head in terms of how you're going to approach it? Were you like, okay, I'm going to go with conventional treatment? Were you thinking like, okay, what can I do holistically? Did you merge those worlds together? I want to know how you kind of navigated that.
Well, so the first response was like, oh, crap, and maybe a stronger word than crap. And, I use those words in my book, but it's interesting because I have a very dear friend, Dr. Michael Taylor, who practices in Oklahoma. He's got a very integrative practice, and he treats a lot of patients walking through cancer. And my very first phone call was actually to him, because I was prepared to get on a plane to go to Germany for 6 weeks and get treatment there, because it was
Did they do fasting? Is that what they were doing?
No, not necessarily. Well, not necessarily, but the whole mindset I had is if you would have asked me if I would have gone through chemotherapy or even considered it or radiation or any of the things that are typical in this country before I diagnosed myself, I would have said you were crazy. I'm not touching that stuff, right? Like, it's poison. I don't like it. It goes against everything that I believe and I practice. And there's no way. Well, that's not a fair statement to make until you're in the situation that you're in, because really, how do you know what you're going to do? But my mind was still there. So in Germany and some other areas around the world, they just treat patients with cancers very differently with some different therapies that don't necessarily always include, the toxicity of chemotherapy or the first line being radiation. And there's conversations to be had to see if there's any alternatives. So I called Mike and I'm like, Mike, Hodgkin's lymphoma, how long do I need to go? How long do I need the kids watched? Like, I'm ready. I don't care how long it takes. I'm going to Germany. And he's like, you're not going anywhere. And I'm like, what? Like, I was waiting for him to, help me pack my bags and encourage me to do this outside of the country. And his response was, look, Hodgkin's lymphoma is 85% curable. You have 3 little kids that need their mom. I was going through a divorce at the time. So like single mom, little kids. He's like, you're going to stay here. You're going to get chemotherapy and you're going to live. And I'm like, okay, I like the live part. Don't like the chemotherapy part. Like, not kosher at all. And he's like, listen, it works. And I'm like I was bummed, right? Like, because I didn't want to go okay to something that wasn't the path that I normally take to treat. So you fast forward, and I did a lot of homework and really more soul searching than homework. And I thought, you know what? I trust this man with my life. It's why I made the first phone call to him. Let's go ahead and check it out. And I found, through a lot of hardship and a lot of firing of other doctors, the right place to incorporate the chemotherapy, but also incorporated everything that I knew how to do along with it. Because my mindset is that they were going to kill me while they keep me alive, and I needed to clean up the terrain that they were going to destroy while they get rid of the Hodgkin's lymphoma. And they did, and I did, and that's how I'm here 10 years later feeling fabulous.
It's so powerful. And something I really took away right there, Dr. Cindy, is you learned really how to empathize with your patients going through this, which makes me curious about this unfiltered approach. I just can't wait to get to know you a little bit more. But when I am feeling very empathetic, I'm naturally unfiltered myself, because that's how we can relate to one another. We tell it how it is. We have to be very truthful. And so I'm wondering if we can kind of kick off into what your practice is all about. Can you give us a little bit facts and tips of your favorite health and wellness, maybe facts and tips using your unfiltered approach? Like what are some things that maybe your patients are surprised to learn about that other practitioners won't talk to them about?
Oh, there's two huge subjects that I love to broach in practice, and one is pretty common now. It's nicknamed the poop doctor, right? Like I always love to discuss fecal material, right? Like the
It's
joke
so
at home is
important.
we can't get through dinner without talking about your poop. What does it look like? What does it smell like? What do you see in it?
Yeah, we
What's
have
going
to.
on? And it's this joke in my office that you can come in with a sprained toe and I'm going to ask you about your bowel habits. What's amazing is how many people are embarrassed by that. And I'm thinking, but we all, like everybody poops, right? Everybody does this. It's a normal activity and some of us do it better than others. But why can't we have that conversation about what it looks like, smells like, feels like? Because we don't know what's normal, right? So I'll give you an example. I had a patient, this goes back many years, and I swear, true story. She walked in, she didn't have a bowel movement for 31 days.
Wow.
Oh my gosh.
31 days. Went and saw the
Wow.
GI, no anatomical blockage, tumors, no reason for fecal material not to move through. And, even though that's the extreme, we also have patients who move once or twice a week that think that that's normal. And if you don't have the conversations about this, they don't understand that a lot of the things they're walking through are common and it doesn't make them weird, but they're also not healthy and not normal. So we have to broach that subject. The second one is sexual health. I love we go to the sex doctor now instead of the poop doctor. And I'll share with you kind of another little interesting story. My background is a DABC, so a board certified internist, goes back all 25 years. I've been practicing that way for a long time. And I've been teaching in the Diplomate program for, 15, 16 of those years. And I teach male and female pelvic disorders. So I'm sitting in class, we're discussing some cases, and I have a doctor who's bringing up a case and talking about a scenario with patients. And he starts to describe the scenario as like, how when you dribble a basketball down the court and you go to make a layup, and sometimes you make the layup and sometimes you don't. And I'm like, did you seriously just describe like sexual intercourse and reaching orgasm as a layup and a basketball game? And he did. And I'm thinking, oh my, like he's a physician, right? And I'm like, we've got to use the right words. We've got to have the conversation. If the physician can't say sex, intercourse, orgasm, whatever the word is, how is the patient going to feel comfortable saying these things as well?
Right.
And it is that transparency of like, we've got to use the right language. We've got to say it looking you straight in the eye. We've got to be able to have those conversations with confidence because they shouldn't be taboo, or weird or odd. And we make them that way. And so in my practice, we don't. And these conversations happen pretty much daily.
And I'm wondering what specifically is taboo right now in the world of functional medicine?
Nothing should be.
Right.
So, right. Like, so how do I answer the
Absolutely.
question? I mean, nothing should be, right? Like no matter what a patient is coming in with, it shouldn't be taboo. I think it's the approach of we've got to make it so that when patients walk in, there's no judgment, right, in whatever they're sharing with us. And it's purely a matter of listening to the concerns, the questions, and then helping them with whatever knowledge we have in a way that isn't judgmental.
Right.
Regardless of the activity, because just because I think it's okay doesn't mean you do, or vice versa. And really, at the end of the day, health isn't about right or wrong. It's about educating so that people can improve their health in a way that suits them.
Of course. Yeah. What about, I'm wondering, are you oftentimes or maybe just sometimes talking to couples together? Or are you maybe suggesting that one patient bring in their partner to have a conversation wherein you can educate both of them on sexual disorders?
Yeah. So the most common is the female that comes in complaining about their partner, right? Who doesn't want to come in to talk to me, and they're dragged in and they're embarrassed. And, again, it's just about, okay, tell me what's going on. And if they hesitate, I will almost come forward and use the words with the questions. Again, are you having any trouble getting and maintaining an erection? How is your libido? Any trouble with sex drive? Is there problems with communication? And just in asking that question when it's not any different than like, hey, how did you hurt your back?
Sure.
Right. And it comes off the same way. It allows them to feel a little bit more comfortable to come in. one of the other things that I find, which actually really saddens me, is in both partners, whether same sex, opposite sex, regardless, is in the sexual health realm when they're not engaging in a good intimate relationship because they don't think they can or they should, based on hormonal changes or age changes or pathology. And it's that misunderstanding that no, we just need to address those things and figure out how to overcome them. Because really, I do believe that we should be able to engage in sexual activity until we're dead, if we want to. There is no limitation to prevent that. So it's overcoming some of those conversations. But we have to ask, if again, we're taking a health history from our patients, sexual health is part of a health history. And I find a lot of practitioners just don't even go there, whether it's on questionnaires or in person. They just ignore it like it doesn't exist.
So even just taking a good sexual history might be taboo for some providers, sadly.
It is sad. And, my suggestion always is if you're not comfortable doing it orally, at least do it on a questionnaire then, right? Because if nothing is answered, then maybe you don't have to pay too much attention to it. But at least if it is, if a patient is willing to share, now they've opened up that boundary line to say, hey, I've shared with you this concern. I want it to be safe to discuss. And maybe then a practitioner will feel a little better about that.
Dr. Cindy, I have to know, so when you're bringing up these topics, whether it's in a patient appointment or whether you're, on stage giving a talk or, I know you've written multiple books, so you're really addressing all these topics that we don't really hear every single day in the realm of functional medicine. How do you handle any discomfort, pushback from your audience? Like, how do you show up so authentically in these spaces? Has it always been that way, or was it more of an evolution?
I've probably been no filter most of my life, but I do think as I get older, it gets easier. And there's less of that. I'm worried about what people think versus I'm more conscious about educating. And, if you think something, because I have no control over that. I love when people give me pushback or they're uncomfortable, because those are the people that probably need to hear it more than those that are. And it demonstrates to me that level of where they might be, where, okay, maybe I come in with a joke, or maybe I come in with a little more sincerity, or maybe I look them straight in the eye to actually address something to continue that discomfort in order to help get them over that hump. So I love that, actually. There's nothing better than having an audience member that's, giving pushback. It's fun.
Yeah. Keeps things fun and exciting for the other audience members too.
Right. And I'm pretty, it's like self-deprecating, right? So if somebody gives me something and I can crack a joke, certainly not at the other person's expense, but at mine, that also creates some levity in the room. And, if we can just get people laughing about an uncomfortable subject, it's really easier to get through. So, I make myself the subject of most jokes.
Yeah. Always a good way to connect. Okay. Dr. Cindy, what do you wish everyone knew about sexual health, but probably don't? When you talk to patients and maybe you're surprised that they don't know certain things about male or female sexual health.
Oh boy, you know what? People don't know their body parts.
I know.
I mean,
so
they really
true.
don't, right? You throw out these words, and we've become this society again that we've called the vagina a flower and the penis a dingling, or whatever silly word people are calling
Private.
things. Private part. Like what's
right?
Okay, private. I mean, yeah, we don't walk around in public exposing ourselves, but we've given things words that we've also lumped into an entire area, and there are multiple parts to the genital area, the pelvic area. And, even that makes it difficult then to get help, because if somebody comes in and goes, oh, I have a bump, where is it? And they don't know how to explain where it is. How do I help them narrow down what they might be dealing with if we can't even localize the problem? So I think that people don't know. There was actually a study, I can't remember who did it, good English, who did it off the top of my head. But there was a study done on tens of thousands of women where they actually came up with a certain percentage. I think it was like 27 or 29% of women who literally did not know their own body parts. Mm-hmm. So it's not even the opposite. It's your own. And yet, I mean, you've been living with it for how many years? You should be able to identify it, see it, understand it. So I think that's the first place to start. You got to learn the parts. Pull out that anatomy book and take a look.
And a mirror, maybe.
And a mirror. Absolutely.
Yeah,
absolutely. It reminds me of one of my favorite stories. So my mentor, his name was Dr. Frank Strail. He's no longer with us. And he taught obstetrics and gynecology at National University, which is where I graduated from. And I was in his very first class. And he gave a test where we had to identify the body parts. And it was like very like cartoonish almost, a black and white picture with the little lines of the body part. You could almost not even tell which body part it was. And you had to label it. And I remember him. I mean, like the one thing I remember vividly from this class is he would come in after this test was taken and he goes, "So you guys did terrible." And we're all like, kind of, "What are you talking about?" And he goes, "There are so many of you that flunked the part of the anatomy to just be able to label the body parts." And with a completely straight face, he looked at some of the women in the class. He goes, "If you women spent half as much time down there as the men did, you would have done better on this examination." And I'm like, okay, to your point, pull out the mirror, let's learn the body parts and let's pass the test. So, even as physicians, some of us don't know what we're doing down there. And it's really important to get educated on the anatomy.
And zooming out a bit, what do you think, just like looking at functional medicine in general, like what do you think we're really getting wrong in this space?
Oh boy, I think we're getting quite a few things wrong, actually. One is the education piece of this, I think, is so complicated because we have a doctorate of chiropractic, of osteopathic medicine, of right, an MD. We have all of these designations, but there really isn't a doctorate of functional medicine. So when we say we're a functional medicine doctor, I think it's difficult for the public to really understand what that means because, again, there's no degree, right? You're not earning that from a university. You're earning a certificate or you're taking some classes and you're getting educated in it. So I would love to see us somehow figure out how to morph into like maybe a DFM, right? Like a doctor of functional medicine, where there's true education along that line that then correlates with some of the other professions. So I think that's number one. I think the other thing is there's a lot of us that dabble. And the dabble scares me for a couple reasons, right? There's a lot of sort of these generic, here's what you can do, and it's a very formula-based program. And a lot of doctors don't take the time to really understand how to manipulate some of those formulas and then relate them back to the actual concerns of the patient to really create a individual specific appropriate approach versus here's a blood test, this is high, go take the supplement. And
It's still
we've got to start
allopathic.
somewhere, right? I mean, we all have different levels of education we have to start, but unfortunately, I think there's a lot of us out there that start and then don't continue and just maybe do a little bit of good, but could probably do a whole lot more good if they'd further that education.
I definitely can see that piece of it, even just like from being a patient on the patient side years ago, where you go and get a workup of, some basic blood work, some micronutrients, maybe a gut test. You're put on 25 supplements and you're like, wait a second, this isn't helping me. This is just very expensive and it's just putting me on a lot of supplements and it's not getting to their actual root cause. I still think that there's a lot of functional medicine practitioners out there that are still kind of using an allopathic approach.
Yes.
And you're not on 15 pharmaceuticals anymore. You're on 15 supplements and we don't know why you needed them in the first place. So I definitely see that.
Yeah, there's two kind of tangents to that I think are also really important. And one is, even though you find something and you may recommend a supplement, it's kind of that peeling of the layer of the onion of going, okay, but what got you there in the first place, right? So like, for example, let's say we have a patient that's iron deficient and we go, okay, we're going to throw them on, whatever, 100 milligrams of iron and see what happens. But how did they wind up iron deficient, right? Like, is there an underlying proliferative disease? Is there a mycotoxin that's competing with the absorption of the iron? Is it just dietary and they're not consuming any products that contain iron? So sometimes it needs, well, not sometimes, I'm going to retract that. All the time, I think it needs to be where we dig a little bit deeper to figure out the why to the what, right? The second thing that I see, and I notice this all the time, and it's one of my passions when I teach, is we also are really good in the space of telling you what to do, and then we don't tell you what to do after that. So here's your product, but when do we retest? What should we expect? What levels are we hoping to see? How do we know when to down dose? How do we know when to discontinue? What if this product doesn't work and we need something else, right? And it's that we're really good up until point A, and then from point A to Z, a lot of us are just kind of winging it because we don't know what to expect and what to do after the initial recommendation. And I think we fail there a lot in the education to help people move past that first point.
Dr. Cindy, how do you foster that education? I mean, obviously you can do it with longer appointment times, but is there anything else you like to do? Are there any kind of resources or learning apps or anything that you've designed, maybe even group programs to educate more efficiently?
So I've probably dabbled in a lot of that. We do, anywhere from just handouts on expectations.
Mm.
I still, and don't laugh, but I still handwrite a lot of things for my patients just because, again,
Yeah.
I want it to appear very individualized versus
I
here's a
love that.
printout from the computer. A friend of mine has created, Dr. E. Greenstein has created an amazing app that's been great for the practice in which you can recommend protocols and exercises and supplements and allow tracking, which has really increased patient adherence, which is phenomenal. Um, Dr. Google. No, I'm just kidding. Try to keep people away from Dr. Google.
Yeah.
But it's really about the time spent. I've done group classes for patients, especially like on the detox weight loss side, where sometimes that camaraderie also helps from an education piece. So I think dabbling in all of those, and maybe depending on the different subjects, different things have worked for me. There's not, even to that regard, there's not a one size fits all.
Right. Depends on the patient's learning style and kind of what you're feeling at the moment, I imagine.
Right. And really what
Oh,
their needs are, right? Like at the end of the
right.
day, I have some patients who don't need any hand holding at all. They just want the information. They're ready to go. They come in educated. They're golden that way. And then I have some who literally, look at you like you're shining a bright light in their eyes, who don't even understand the basic words that you're using, that
Right.
need to come in more often and need the resources and the hand holding. And, again, everybody's really different. So we meet the patient where they're at, not where I want them to be.
Sure. And I want to get into some of your specifics as far as the therapies you offer, Dr. Cindy. And this one I have never heard of before, the Winback TCAR. I'm not sure if I'm pronouncing that correctly.
Takar.
TCAR, Winback
Takar
TCAR therapy. How it works, why it's exciting to you, what are you using it for, what's the indication? I see you put in aesthetics in preparation for this. So I'd love to hear about this Winback TCAR therapy, please.
Yeah, it's really interesting. So this company and technology really found me through a friend, and I was asked to vet the therapy and use it in my practice to see if I could come up with some protocols and some unique ways to use it. And I had never heard of it either. It's actually very big in Europe. So a lot of the physical therapists are using it over there. The sports teams, you go there, it's not a foreign topic. And TCAR itself stands for the transfer of electricity, resistive, and capacitative. And for those of you out there that are old enough to remember diathermy, it's similar to diathermy. So it has the ability to bring blood flow to the area, to reduce inflammation, which a lot of therapies do. But what's a little unique about this particular therapy is it goes down even all the way down to bone level. But on a cellular level, it helps to open up the cell to remove toxins and allow the nutrients to go into the cells. It generates, I want to say that differently. It allows the tissues to respond with warmth. So it is a heat technique, if you will, but the body's response by heating up, not that the equipment produces heat. So we brought it in, and it's amazing, not only from a musculoskeletal standpoint, but we treat constipation, endometriosis, pelvic dysfunctions with it. We're now doing aesthetics, which is really cool because it stimulates collagen synthesis and hyaluronic acid. I mean, we're getting rid of wrinkles and lines and all kinds. Not me, of course, because I don't have time to treat myself. We're only treating patients, so I haven't been a patient yet. But we're getting some absolutely phenomenal results. And it's been a fun technique because A, it's very safe, B, it's extremely effective. And especially on the aesthetic side, like I have patients that won't tell me they're getting Botox, right? Because they come in for all this natural stuff and they don't want me to know that, right, that they're getting that. And it's fun because when they learn that we have this and they're like, oh, I shouldn't tell you this, but I've been getting injections for the last 6 years and maybe this is a better therapy. And we're moving them over to something just much safer. And it's really fun then to be able to offer something, because if they're coming in for me for all this natural, good, holistic stuff, and then they're going to get Botox, a little bit of a, conflict there, I think, emotionally in the way you want to treat yourself. So it's been a great therapy. We absolutely love it.
Can you dive a little bit more into how it actually works? Because it sounds like you said you can use it for aesthetics, kind of more superficial, but you were also mentioning it can be used in some conditions that are, organ-based. Like, can this penetrate deep into to different tissues? How does
so it's all about frequency.
Paint the picture.
Yeah, it's all about frequency, right? So there's different frequencies and settings within the equipment that you can use in order to penetrate a certain depth. right?
Okay.
So that's how we use it. So if we don't want to go deep, using a certain frequency to stay superficial is much more important because, like, let's say we're working on the face to tighten the skin. We don't necessarily want to get deep where we might affect fat, right? Because we don't want anybody looking emaciated. But yet, if we want to get down to, let's say, bone, somebody's got a broken bone and we want to help stimulate bone growth, superficial frequencies aren't going to make an ounce of difference. And what's really cool is some of the new technology is also coupled with electric stim and high tens. So for people out there that are using some of those modalities, now you can couple them, which saves the patient and the practitioner time, and then can help, speed up the healing process because you're getting really 2 or 3 therapies, at the same time instead of one. So it's all about frequencies.
Interesting. Is it painful? Have you had it?
No.
Oh, it's not. Okay.
It's not. So when you think electricity, right, you think about, right? Like
I'm
a
like,
little
this
different.
sounds like it's going to shock me.
Yeah, not like a shockwave where you got to endure a
Okay.
little bit in order to get through.
Yeah.
The only potential for discomfort really with the machine is based on your body's response by heating up. So we're always checking in with the patient. They should feel heat to the temperature of about a warm washcloth. And if it starts to get higher, we just turn down the intensity and make sure that we're not going too high in order to stimulate heat. But it's all based on their body, not the equipment. The equipment doesn't put out the heat itself. It's the body's response. So with patient input, we can keep them super comfortable. We have patients that are falling asleep on the table when they're getting treatment. It's that relaxing.
Oh, nice.
Any contraindications? Any implants?
Yeah, there's a couple.
Yeah.
So certainly we don't want to be over an active blood clot because we actually don't want to move things, right? That's pretty important. If anybody has any electrical stim type apparatuses in their body, because this is electrical current, probably not a great idea to go over that as well. We're always very careful about recommending with pregnancy because nobody wants to volunteer their body during pregnancy to see the safety. So we would always err on the side of not over pregnant belly. And then lastly, active cancer sites. Certainly, again, we don't want to bring blood flow and increase what's already going on in that area. So anybody with active cancer, we stay away from those areas as well.
I'm curious, Dr. Cindy, you mentioned your plan to go to Germany for cancer treatment. You mentioned Winback to CAR therapy more popular in Europe. What's your take on, overall, we do hear about more novel therapies or, just more options in Europe, especially when it comes to some of these cutting edge technology devices. Why are they jumping on this kind of way ahead of the curve?
Wow, I wish I had a great answer for that. We're so slow here. I'm going to give you the sort of the soapbox pessimistic answer. I'd have to think it has to do with corporate medicine and pharmaceuticals and money. At the end of the day, if you follow that trail, it's probably what it's all about. Listen, this country is making billions of dollars off of pharmaceuticals. And if we can come in with a therapy that eliminates some of that, there's going to be some very unhappy businessmen and corporations. So, can't prove that to you in particular, but as a conspiracy theorist on a rare occasion, I'm going to say it's probably money in corporate.
This tricky stuff. Yeah, for sure. What about functional medicine labs? What are your go-tos? What do you like to use I'm also kind of curious, for your pelvic pain or pelvic disorder patients, what kind of labs are you looking at?
Oh, yeah. So there's lots of them. There's lots of tools in my office. I always share with people, I have 4 baseline tests that I recommend. The first one is a very comprehensive blood workup. So CBC, CMP, hemoglobin A1C, LDH, iron panel with ferritin, transferrin, full thyroid panel, which means TSH, free and total T4, free and total T3, thyroglobulin antibody, TPO antibody, T3 uptake, reverse T3. I know I'm doing that fast, but we got to get it in.
It's necessary.
Inflammation markers, ESR, sed rate, CK, amylase, lipase. I'm sure I'm forgetting a few here. Lipid panel. And looking at it then again homeostatically. So not just in that clinical range, but really in a nutritional range, because we're not always sick, but we're not always perfect. So that's number 1. Number 2 is I love, and you guys didn't tell me to do this, but I'm going to say it for real anyway. I love Vibrance micronutrient test. That's number 2 in my baseline, because if we don't provide on a cellular level all the nutrients that we need, we don't function well. So I love that we look at it intracellularly and extracellularly. That's really hard to say. And occasionally in the red blood cell, and looking at that data versus just, do we think they're deficient or not? Or when a patient says, do I need vitamin E? My answer is, I don't have any idea. Let's find out. Right. So I love diving into the nutrients, the antioxidants, the omegas, everything that panel offers as sort of this baseline nutritional, how do we make sure you're getting what you're needing? Third thing I use is what's called a metabolic performance profile. And this is from a physician's lab out of Florida. And what I love about this is it looks at really like the metabolites or the analytes that are used on different pathways. So are you methylating? Can you use magnesium? Are you metabolizing your amino acids? What's going on with cardiovascular and inflammation? And the way I describe it to patients is if we give a nutrient, we have an input, we expect an output. But we don't really know what's happening between taking it and getting that output. So when we can look at all these analytes or pathways and go, maybe a patient isn't methylating, or maybe they need, SAMe in order to do something else with that particular nutrient. Now we can help facilitate those pathways better to get better outcomes. And especially if something isn't working, you give a B vitamin, the levels aren't changing, you're still tired, something's broken. And then the fourth thing is a genetic profile that I'm doing through Professional Health Products. It's a 100 SNP test. And the reason we picked 100, even though we know there's thousands more, is the 100 are very specific in terms of we've got a lot of literature and research now to know that we can affect those genes in a way to either get them to express if we want them to express positively or turn them off to not express if it's a poor gene. And even though there's thousands of them, a lot of times it just freaks patients out to know they have a problem if we don't know what to do about it. So I like to focus in on the ones that we can really facilitate change on. So those four things are my baseline. I think every human being should get them no matter what. We start even at young ages because why wait till you're sick to figure it out? And we go from there. And then a lot of those tests, except the genetics, that's a one-time only. The other three I recommend annually just to keep you healthy. But then, see, I'm exhausted now telling you about all these tests. I had to breathe there. Then we run down different pathways. So there's the gut pathway, right? Anywhere from food sensitivities, looking at the Zoomers and the relationship in the small intestine of the reaction of the polypeptides, all the way down through the small intestine and the large intestine, which we know is the basis for the immune system. And very rarely do I see anybody with a great gut Zoomer test. Rarely. And yet I think it's an essential test. Really probably should be in the baseline. We'll make it like a baseline plus test where everybody should get gut work. Sometimes then we run down the hormones where we're looking at adrenals and sex hormones and the precursors and analytes and metabolites for the sex hormones.
I do want to stop right there really quick on hormones. Can you kind of break down how we should be going out about hormone testing? Because I know there's a lot of confusion around testing women's hormones. Like what day do you have to go do your labs? Does it matter? Because I think a lot of people, they'll go to their doctor, they're asked for a hormone panel and they're like, oh, I'm good. It's like, is that enough? Like, is testing them by blood okay? Let's dive in.
Well, so I'm old school. And when I say old school, the way I learned to test hormones was through saliva only initially. And we were taught back in the day that blood is a bound hormone. Saliva gives you a free fractioned hormone. So it's a little more accurate to get saliva. I've since now incorporated urine testing to look at the metabolites as well, because we've come a long way since I learned this 25 years ago. To answer your question about what day, I've had numerous debates, especially with different OBGYNs about this, because I definitely have a pretty strong opinion. We look at typically day 3 and day 21 in the medical space to look at hormone levels. The problem is if you have a female that doesn't have a normal cycle, her levels might be different on day 5 and day 23 or day 8 and day 28. So how do we look at 3 and 21 when everybody isn't a perfect specimen of hormone production in a way where we know we're getting a completely accurate picture? So I'm a big fan of, if you're a menstruating female, we map it out. We take multiple samples through saliva and we map out what the progesterone and the estrogen look like over the course of the entire cycle. Testosterone, not quite as important. And then we run all those metabolites to look at the precursors. What is the role of DHEA? What is the role of pregnenolone? What is the role of the liver detox to help us get rid of some of the estrogens? Are we methylating, some of the hormones? So, I think on a rare occasion, like for example, if I have a woman who comes in, she's pregnant, one of the very first things I do is order a progesterone level, because you need adequate progesterone to maintain a good pregnancy. If I run that through saliva, that's going to take me 3 weeks to get back. If I run it through blood, I'm going to get a really quick answer, and I can at least get an assessment of where she is approximately on that hormone on that day to see if her level is good. So I still think there's a time and a place to read blood hormone levels. I do. But I think to be more thorough, we really got to go down that saliva and that hormone, that urine pathway and look at mapping when they're menstruating. And actually, this is going to sound a little crazy probably for your women that are not getting a period. And I don't mean menopausal not getting a period, but younger. I actually like to map that as well, because if I can look and start to see that there's some inkling of a normal pattern in there somewhere, even if she's not menstruating, then I can target my treatment a little bit closer to what her body might be trying to do and mimic that versus we truly have no idea.
And do you like to use things like, do you use any like bioidentical progesterone or progesterone creams or supplements only? Or what's your kind of approach there when you do have someone that's not balanced?
Yeah, no, it's a great question. I mean, I don't do any prescription medications, right? So from that aspect, there's no prescribing. But I do use homeopathics, I do use creams, I do use herbals, I use combinations of things. Anything we can do with the least amount of potential side effects. So if I can do something herbal, I do. If I feel I need something stronger, then I absolutely go down the cream or the oral route in order to try to mimic the proper hormone.
And from my understanding, when you have someone that has some hormone imbalances, we can't start with hormones, right? Usually we got to start somewhere else, whether it's gut, whether it's liver health, whether it's toxins, because all of those things are going to have effects on our hormones, especially if we have really high stress levels. So when you see someone with like estrogen dominance or low progesterone, like where do you kind of question them, or where else do you look?
Right. And I do think it's bidirectional, right? There are some patients that just want the hormones run. And they're like, okay, I don't care about anything else. Tell me what my levels are. And if they ask for that, I actually do give them what they ask for. So sometimes we do start there knowing that we're going to have to dive a little bit deeper because they didn't just get there on accident. I think the history is really, really important where you also obtain exposures and diet. Because we know the Western diet breeds a lot of hormone dysfunction, caffeine, alcohol, dairy products, meats that aren't clean, chemical
Birth control.
Absolutely. Absolutely. Birth control. Some of the things that we breathe and we're exposed to. One thing that's really important too, that I think a lot of physicians overlook is sometimes we're really good about asking people their careers for exposure. We're not always so good about asking them about their hobbies and what they might do on the side or on the weekends and what they could potentially be exposed to that could be considered, let's say, xenoestrogens or toxins that are driving the hormone pathways. So I think it has to start with a really good history before it even starts with testing. And then, the gut, right? The gut's the answer to 90% of our problems, I think, in terms of looking at that. But, it's looking at the heavy metals, it's looking at the mycotoxins, it's looking at viruses that could be stimulating a pathway that leads us, down to hormone dysfunction. And it all comes back to, what I said a little bit earlier of not the what, right? So we know the hormones aren't balanced, that's the what, but the why. So what underlies that we got to keep digging? And you got to start with a great history. Patients, they teach you in school, patients will tell you exactly what you need to know. You just got to ask and let them talk.
When you have patients come in, do you ever work with women that are trying to transition off of birth control, or they've been on it? I think a lot of women have been on it for a very long time from a young age, because it's when you go into the doctor's office at 13, 14, 15 years old for migraines or headaches or literally any symptom under the sun, they just throw birth control at you and you're like, all right, you're good. And then 10 years later, you're like, oh, why do I have all these nutrient deficiencies and I don't feel good? And, I can't be on it forever. So what is that? I know that can take a while to detox out of the body and correct all of the issues that, may have occurred during that time. How do you approach that?
Yeah. So any woman that's using it for birth control, that's a tough conversation. And that's probably the one thing in practice where I'm like, I don't have an herb for you, right? Like there's no product on my shelf I can pull off that's like, here's your birth control, good luck, hope you don't conceive. As long as they're using it for something else and they're ready to make that transition, I actually think it's pretty easy once they're committed to doing it. So we ask them to and listen, like anything else, I'm not the prescribing physician, so technically they should go back to the prescribing physician. But let's say they make the choice to discontinue the birth control on their own. I ask them to stay off of it then for 60 to 70 days. It takes about that long for it to get out of the body to where we're getting a really accurate result. And if they're absolutely miserable during the 60 to 70 days, then we treat, whether it's chiropractic or acupuncture is a great modality to get them through a lot of the dysfunction and the symptoms, or even some herbal things, to try to ease the pain or the symptoms. And then once we've got them off for that 60 to 7 days, we actually do the hormone work, looking at cortisol, DHEA metabolites levels, because there's usually a reason. So like, for example, actually one of my favorite patients was suffering from migraine headaches that were always cyclical. It was always a certain time during her period. And even with birth control, she was still having that problem. So discontinued the birth control because it clearly wasn't helping anyway. And when we were able to map out her hormones, it was really interesting, but yet made sense. She would get this spike in estrogen and then a massive drop and then another massive spike. And the headache would always occur right before that massive spike of estrogen. So we knew that the headache was related to that roller coaster that she was going through. And because we were able to see it, birth control wasn't the answer anyway. It was really about regulating and helping to filter out some of that extra estrogen. We use things like DIM and calcium D-glucarate to help get that onto balance. And after a couple cycles, 2 or 3 periods, the headaches were gone. The estrogen wasn't, behaving like a roller coaster, and no need for the synthetic, hormones that weren't being used appropriately anyway, because, birth control isn't for migraines.
No.
Or at least
You got that right.
At least it shouldn't be, right?
Yeah.
Totally.
Yeah. Absolutely. I do want to ask if you could go back in time and give one piece of advice to, Dr. Cindy, maybe 10 years ago, 15 years ago, 20 years ago, that was just starting out in the field. I think you said you started 25 years ago. Go back to your younger self, just starting out in this field. What piece of advice would you give?
That's a great question. And it's a hard one for me because I walk through my life without really regrets. I'm so appreciative of all the decisions I've made, good or bad, to lead me here. I don't know. I think I would have, I think the advice is really just to even have listened more. When you're younger, you tend to just jump in and go instead of sort of sitting back and taking it all in. And I think I would just tell myself, like, just be quiet more and just listen to patients, to practitioners, to people who are experts who have been doing it way longer than I have, just so that I could have probably taken in even more than I already have.
Become a student of your patients.
Always.
A little bit.
Still am.
Yeah. Yes.
Still am. They teach me every day.
What's something that's really shocked you that you've learned recently? Could be a case study, a patient you worked with, something you read.
Wow, I don't get shocked too easily. Not that I've seen it all, but I've seen a lot of crazy stuff.
Or what are you really excited about right now? I mean, the book sounds amazing. So I imagine that's probably one thing.
Yeah, thanks for letting me pivot on that one. I didn't have a good answer for that one. So I love the pivot. I appreciate you for that.
Of course.
Yeah, you know what? It is an exciting journey. So I love my clinical practice. I truly do. And I don't see myself ever not practicing. But I also love to just educate people. It's fun to know that people want to learn and will listen. And even if there's just one little tidbit that they can pick up, it jazzes me. It's like my ultimate high. So now on this journey, even though I've been teaching for, again, the 15, 16 years, and I'm on stages all over the country, I'm trying not only to stay in the medical space or chiropractic space. I'm teaching for continuing ed, but I'm now getting out and doing more of the keynote speaking. I want to get out to corporations and lay people and organizations to share the story of how I walked through adversity, because it's not just cancer, it's adversity, and motivate and learn both directions so that people realize that no matter what, crap's going to come our way, right? Like, you don't walk through this life without some sort of trouble or conflict. And yet we can really choose how we do that. We can embrace it and respond to it in a way that we learn and grow, or we can become a victim and, feel sorry for ourselves. And I don't like that choice so much. So getting out there to help people see some of that has been really, really fun. And I can't wait to see where it takes me.
Yeah, you're like walking, breathing, living proof of like, hey, you do have a choice and a decision on how you're going to navigate, whatever life really throws at you. And I love seeing you in a more educational role, because then you're not one-to-one with a patient anymore. You're one-to-many. You're touching more people, getting them inspired. So I love that.
Yeah, it's really fun. And the book was really it was interesting because I kept a diary of the book. I mean, it was never a book in the beginning. It was really a diary or a journal through my days, right? The good, the bad, and the ugly. And there was a lot of ugly in there, and there was a lot of great stuff in there, and it was very vulnerable. And when I was done with treatment, I actually put it away, and I thought, this is for me, and maybe the kids will read it when I'm dead, and they'll find it, and because I didn't burn it before I went, and it really wasn't for anybody else, for me. And then I don't know, many years later, because I've always wanted to write a book and I didn't know what I wanted to write it on. I thought, no, you know what? It's really time to bring this forward because it's not so raw and close to me anymore, because it feels like a lifetime ago. And I was finally ready to share all those stories. So if and when, and I hope everybody will read the book because it's a quick read. It's a little funny and it's a little sad and it's a little self-help and it's a little medicine, but there's a lot of just fun stuff to read in there, and you'll learn about me, but no filter. Again, I use words maybe I shouldn't, and I tell stories maybe you don't care about, but it was mine to tell, and I decided not to hold back and keep anything out of it. And so you really truly get my voice and the raw emotion of what I walked through for 6 months, and then some aftermath. There's some follow-up at the end of the book.
And vulnerability is like a superpower in today's world. That's what people want. They want raw, unfiltered. They want to know. We live in such a world that's so polished and filtered, especially with social media. So I can see that being a really great resource for really anyone in this space.
Yeah, thanks. It's hard to do because there's so much judgment too, right? It's so I'll share with you a funny story. When I was working on the book, the working title was "Pregnancy is Worse Than Cancer."
Oh my gosh.
Right? And for me, it actually was, because I had a terrible first pregnancy. I actually almost died. And walking through Hodgkin's, actually, I kind of almost died there too. But you got to read the story too.
And you have 3 kiddos, you said.
I have 3 kids. Yeah. So I was, as I joke, dumb enough to have 2 more after I almost died with the first one. I had HELLP syndrome. And so my platelets were 30. And I was basically bleeding internally to death. And they had to deliver her to save my life. She was born at 2.5 pounds. And she's amazing. She's now 22 years old. She's flying airplanes, and you'd never know she was a preemie. She's just a little powerhouse, and I'm proud of all of them. But
fabulous.
Especially the way she started, there might be a little extra pride there. And so for me, I was probably the most miserable, just horrible pregnant woman on the planet. I hated being pregnant. And when I walked through Hodgkin's, I actually wasn't miserable and horrible. I took a different approach. But what was interesting is there was a acquaintance of mine who called me out on the title of the book, because she had walked through breast cancer and she didn't have a good experience. And most people don't, let's face it. They don't look at it as a gift. And she said, "How dare you say that pregnancy is worse than cancer? That's a horrible thing to put out. It lessens the fact that cancer is horrible for a lot of us." And I said, "You know what? You're right. But that was my experience. Pregnancy actually was worse for me than cancer." And when you talk about being vulnerable, even though I pride myself on learning over the years to really be able to do that, I still changed the title of the book and made that a chapter title, because I still was conscious of the fact that I don't really want to walk through life purposely offending people. And at the end of the day, I still do really care what people think. I mean, I'm not going to make choices because of that, and I'm still going to be true to myself. But, if I said that words didn't hurt me or people couldn't affect me in a way that wasn't always positive, that's not truthful either, right? We have moments that sometimes things are painful no matter what. So the vulnerability was great. The pain is still there on occasion. But, again, I think just due to what I've been through in age, you just learn to let most of it roll off of you and pick and choose when it's important to pay attention to.
Well said.
Well, thank you so much, Dr. Cindy, for everything you brought to the show today. We dove into so many interesting topics. I'm super interested in that therapy we were talking about earlier. I feel like I'm going to have to go do some research on that after the episode. Maybe we'll connect on it later.
Sure.
And even just all our talk on hormone testing, all the lab work that you do, and just your approach to functional medicine, or what we call functional medicine today, in general. So if anyone listening today wants to connect with you further, order your books, get to know you more, where can we find you online?
Oh, great. So if you want to purchase the book, I'm on Amazon. Kindle, hardcover, softcover. Just go to Amazon, Positively Altered, Finding Happiness at the Bottom of a Chemo Bag. If you're interested in reaching out to me from a speaking standpoint, I would love to come chat with your organization. There you can find me at hello@drcindyspeaks.com is the email. drcindyspeaks.com is the website. And from a practice standpoint, the practice name is Innovative Health and Wellness Center. I'm in Orland Park, Illinois. And the website is innovativehwc.com. And the phone number is 708-479-0020. And wherever I can help, I would just love to. So do reach out. And if you pick up the book, let me know what your favorite chapter is. I'm always curious what people think.
Yeah, leave it in the comments for us. If you read the book, let us know. And we'll be sure to link this all down in the show notes for you guys. So you can find our website, find our book online. And thank you so much again, Dr. Cindy, for taking the time today and for everyone tuning in. Until next week, wishing us all vibrant health and wellness.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.